The Austin Metro is one of the fastest growing areas in the country for the senior and pre-senior populations, and with that comes the need for additional health care. Joining me today is Chris Roussos. He's the Chief Operating Officer for Harden Healthcare to explain the concept of hospice care. Thank you so much for being here this afternoon.
Thank you very much for having me.
Hospice care typically means end-of-life care, is that right?
Yes, it does. It does mean that. And what happens is a team of hospice professionals will then work with the patient and family once the patient has received a life-limiting illness, and we take care of the physical, the spiritual, and the emotional needs of both the patient and the family as they're on their end-of-life journey.
And all of this is done in the comfort of the patient's home, is that correct?
Exactly, wherever they call home. It could be in a house, it could be in a nursing facility, assisted living, wherever the patient and family is, we will come to them and we'll provide wonderful hospice services for them.
What do you find are maybe some common misunderstandings about hospice care?
Well, one that a lot of folks, first of all, we just touched on a little bit, was that hospice is a place or it's a house, and it is not. Again, it's a service that comes to them. I think second is probably another really significant one is the concept of hope, and when someone, a loved one goes on hospice, is that you lose hope. And we absolutely think that we hope with the patient and with the family, and we spend a lot of time during that end-of-life journey creating wonderful moments for the patients and for the families so they can really celebrate their final days together and really have a sense of hope with their loved ones.
As you mentioned, it's more than just medical care. When should a family consider possible hospice care for a loved one?
Well, it's obviously a very personal and intimate decision, but when they see a loved one that's had a decline in their health and they've received a diagnosis of a terminal illness, that would be a great time to either speak to their doctor and or call a hospice provider, and we could answer their questions. And I think from there, then we can contact their doctors and we can get the process started of bringing them on hospice services.
Is it live-in 24-hour care, or does it vary? How does that work?
It is not live-in 24-hour care. What it is actually a typical hospice patient and the family will see hospice care providers, of course, whenever they need, but it's normally 25 to 30 visits a month, so we're typically in there daily. Right. And we're providing everything from bedside assistance to, again, spending time with the family and the patient, and also just helping the family really focus on being a member of the family instead of a caregiver, so that we can help them and lift the burden of that end-of-life journey, and they can again focus on their loved one.
Healthcare costs obviously can be very expensive. Is this something that is typically covered under insurance, or how does that work?
Yes, actually insurance is a way to pay for hospice services. Also, you see it being paid for by Medicare and Medicaid, and additionally private pay by families.
We want to let you know, first of all, that Lighthouse Hospice, which is under Harden Healthcare, has recently changed its name to Girling Hospice, Texas. And we want to tell you that if you are interested, or if you have a family member that you think might need hospice care, to contact them and for a consultation. I guess that's the best way to get started.
It would be, and as you go to our website, it's girlinghospicetexas.com, and there's some wonderful videos actually by caregivers and chaplains, and it could really answer a lot of questions and help our viewers.
Chris Roussos, the Chief Operating Officer of Harden Healthcare with Girling Hospice, Texas. Thank you so much.
Thank you so much. Thanks for the opportunity.
Absolutely.